We know it's a challenge to get your patients to floss, and despite their best intentions, patients tend to exaggerate how often they do floss. Today, there are a lot of new flossing alternatives and techniques that promise to make flossing easier. As professionals, what can we do to sort this out for patients? A good place to start is the research.
As a clinical instructor and an academic, it's important to me that I know that the science behind the research is sound.
Believability stems from the journal that it's in.
I like to see that it's an outside company other than the manufacturer who has done the research.
And the research is conclusive. Using an optimal combination of pressure and pulsation, the Waterpik Water Flosser removes plaque biofilm both subgingivally and interproximally, and massages and stimulates gingival tissue to promote improved circulation, healing, and superior oral health.
I started my practice about 5 years ago, and one of the things that I had set out to do from the start was institute a hygiene program that worked.
In study after study, the Water Flosser's unique ability to remove plaque and reduce gingival bleeding and inflammation has been proven. In a study at the University of Southern California, the Waterpik Water Flosser was proven to remove up to 99.9% of plaque biofilm from treated areas.
You apply the Waterpik to plaque on a surface of a tooth, and you look with a scanning scope, and it's gone. It's simply gone. And that's unequivocal and unarguable.
In other studies, the Water Flosser was up to 50% more effective at reducing gingivitis compared to string floss, was up to 2 times as effective as traditional floss for reducing gingival bleeding and improving gum health, was up to 3 times as effective for plaque removal in orthodontic patients. And in a recent clinical study conducted at Tufts University, the Waterpik Water Flosser was more than twice as effective as string floss for reducing gingival bleeding around implants.
We've been using the Waterpik in our practice for 25 years, and the research that I've seen on Waterpik certainly backs up the clinical efficacy that's been apparent to us over the years.
And best of all, water flossing is easy and takes just a minute a day, a real plus for patient compliance.
They'll have stacks and stacks of free floss that I've given them for years, and they're not using it, but they will use the water flosser.
The results are clear. In study after study, the water flosser is unquestionably the easier and more effective way to floss. But what about air floss? In studies published in 2012, the Waterpik Water Flosser was compared head-to-head to Sonicare Airfloss, and once again, the water flosser was proven to be the superior choice for your patients. In a 28-day study, the Waterpik Water Flosser was found to be up to 80% more effective than Sonicare Airfloss at reducing gingivitis, and up to 70% more effective for plaque reduction.
When I saw subsequently the results comparing water flossing to air flossing, I was not at all surprised. They simply bore out the conclusions that I had come to in my own mouth.
I found that if things are easy to use, patients are more likely to use them every day. Waterpiks give very positive feedback, and the end result is when we take off their braces, they have a beautiful functional smile that they're proud of, and I'm proud of.
And now there are even more ways to meet the needs of every one of your patients. Introducing the new Waterpik Aquarius, the most advanced water flosser ever. Aquarius is the new professional-grade model with advanced features and a new sleek and ergonomic design, with on and off water control on the handle for greater ease of use. 2 water flossing modes, floss for the ultimate in interproximal cleaning, and new hydropulse massage for enhanced gingival stimulation and circulation. A 1-minute timer and 30-second pacer to ensure thorough water flossing of all areas. 10 pressure settings for optimal control. And 7 tips, including all of the specialty tips for orthodontics, implants, and deep periodontal pockets. The new Waterpik Aquarius, professional-grade water flossing technology that's easy to use and effective for your patients. In addition to the Aquarius, Waterpik has created a full line of professional products that are exclusively available through dental offices and online. Or, if you prefer to recommend that your patients purchase products at the store, Waterpik continues to offer a complete line of retail products. With several new products and new clinical research, Waterpik is the brand that's clinically proven to improve your patient's oral health and improve compliance.
In particular, I'm impressed with the clinical studies that show reduction of inflammation, improvement of overall periodontal health, and also reduction of various biological mediators that foster the advance of periodontal diseases.
We pride ourselves in the latest technology, all digital and everything. And when a patient's done having their mouth restored, I certainly want that to be maintained for a long time.
Waterpik is effective. I've seen it in my practice. When patients ask me, do I have to floss? I'll tell them no, I don't floss. And they look shocked because here's a hygienist telling them I don't floss. But at the same time, I always chase that with a but. I use a Waterpik.
In today's busy world, it's more important than ever that what we prescribe for our patients is quick, easy to use, and clinically effective. And the Water Flosser is just that.
My main message to dentists and other hygienists is to use it yourself. See how great it works, and you will be excited to be telling your patients to use it.
There are very few things that I can point to in my dental career that I can say were major game changers. Water flossing is one of them.
Try it yourself. Recommend it to your patients. The Waterpik Water Flosser, the easy and more effective way to floss.